So the weather's starting to get nicer. We're having some really lovely warm sunny days. So I'm going to talk to you about sun protection and when to see your GP if you're concerned about a mole. So first of all, sun protection. We would really recommend staying out of the sun in the very hot part of the day, so roughly between about 11 and 2 o'clock. If you do need to be outside, making sure you wear a sun protection. There are other brands available, and we would recommend an SPF of 30 and above. And we would also advise to wear a hat, particularly one with a peak and ideally a brim so that your ears and your face is covered as well. So moles, when to see your GP. So if you're concerned about whether a mole has changed, that would be a good time to see a GP. As a rough guide, we also follow the ABCDE guidance. So A stands for asymmetry. So if you see any irregularity within the mole or it looks a bit different. B is the border. So again, if you see that the border is no longer smooth with a nice regular outline, if it becomes irregular. C is the colour. Again, if you start to see any different colours within the mole and it's not a uniform brown, that's when to see the GP. D is the diameter. As a rough idea, if it's larger than the tip of a pen, which is about 6 to 7 millimetres in diameter, and E if it's evolving, so if it's changing. It's a good idea to take a photograph at home on your own and then we can compare it and you can keep it for future record. When you see the GP, they may take a special photograph using this camera, which is a dermatoscope, and send it to the dermatologist for their advice. So don't forget, the most important thing is to look after your skin in the sun and don't forget your SPF.